Thanks, Lauren.
We're looking at this week's health headlines. Joining us now is professor at Northwestern University Medical School and WGN Morning News medical contributor, Dr. Lauren Streicher. Good morning.
Good morning. Let's start with mammograms. 1 in 5 women don't intend to get one.
Isn't that unbelievable?
It is.
This was a survey of women, thousands of women across the nation, and they were targeting specifically women who were at an age when you should be getting your first mammogram. The American Cancer Association recommends 40 as the age to get started. So they were talking to women who are in their late 30s, early 40s, and it's not like they were saying, well, I'm not going to get it right now. They're saying, I am never going to get a mammogram ever. Which is really frightening. Well, when you talk to people about why, first of all, they'll say, you know, it's expensive, it's uncomfortable. I know someone who had a mammogram and got breast cancer anyway. I know someone who got a mammogram and had to have a biopsy, then everything was fine, and I'm just not going to bother. But in a related study, they looked at risk factors, and do women even know risk factors for breast cancer? And what they found is that most women don't. While they know that, yeah, family history is important, 40% of people don't even know their family history, and 90% of women have no idea that if you have dense breasts, you're 4 times more likely to get breast cancer. And you're only going to find those dense breasts on a mammogram. And the #1 message that I need to get out there is that if you have a mammogram, they're not perfect, but you are going to find those early stage cancers, the stage 0 and 1, that have over a 90% survival rate. So you got to get those mammograms.
Yeah. All right, our next headline, current cervical screening guidelines are failing women over 65.
Yeah, and another screening story. It used to be so easy, you know, you go to the gynecologist every single year and you get your Pap test until you die. And then they've changed all that in the last few years. And 5 years ago they said, if you are over 65 and low risk, you do not need to get a Pap smear. And I mean, let's face it, women were rejoicing, doctors were rejoicing because they didn't need to bother with it. But now the numbers are coming out, and surprise, surprise, what we're seeing is that we're having increased numbers of cervical cancer in over 65. They are being diagnosed at a later stage, and more people are dying. So these recommendations are not serving women over 65 very well.
It makes you wonder about the recommendations by experts.
Exactly. So there's really 3 reasons in my mind why these recommendations are failing. One is they're very clear that this is for low-risk women. And that means you've had a normal Pap test for the last 10 years, and it's just kind of across the board. People aren't doing it. And the second reason is that a Pap test and a gynecologic exam are not the same thing. So people say, if I don't need a Pap test, I don't need to take my pants off. I don't need to get a gynecologic exam. So no one is looking. No one is looking. And the third thing is that, let's face it, cervical cancer is caused by HPV. How do you get HPV? Through sexual activity. 50% of the population over the age of 50 is single. They're out there. They're not necessarily using protection. We're seeing a lot of HPV in this age group. So bottom line is yeah, get your Pap test, particularly if you're high risk. And even if you're not getting a Pap test, go to the doctor and have a gynecologic exam, because if your gynecologist doesn't look at your cervix, who's gonna?
There you go. All right, the dirtiest part of your kitchen might surprise you.
Yeah. I was surprised on this one. There are 1 million people every year in the United States that get a foodborne illness, and most of this comes from their own kitchens. So in this study, they had 300 people, and they told them, make turkey burgers in a salad. They gave them a recipe. They thought that they were just testing a new recipe. They had no idea that they had implanted a harmless but traceable bacteria in the ground turkey, so that afterwards they can then swab the surfaces and see what was the germiest area of the kitchen after these people made their turkey burgers. So Larry, you want to guess? What was
spices.
Spice rack.
We've been
Oh, it's
showing
there, you
that.
gave it away. So, okay, no one knows that, but it is the spice rack.
Yeah.
Because think about it, you've got your ground turkey and your sprinkle, sprinkle, sprinkle.
Yep.
And then you, even if you wash your hands, it's on your salt, your pepper, your spices. So you've got to wipe those down. But it was #1, and they found it in, I think it was like 70% of people. And I forgot to mention,
That's Dean. We know yours are clean, Dean.
half the people in this study were given instructions on food safety. It didn't matter. It didn't matter. #2 is counters and cutting boards, so be careful about those two.
Well, thanks again for being here. You can check out Dr. Streicher on social media. We'll see you soon.
Thank you, doctor. Time now for Around Town.
Hey, Anna.